All right, so I'm going to talk about disorders of the respiratory tract. One I'm sure you've heard of is asthma. For reasons we don't understand, it's getting more common. It's more frequently diagnosed these days in children. Presumably there's an environmental reason for that, but a lot of research has gone into it and we still don't have clear answers. But it's a chronic respiratory condition, and you effectively get narrowed pathways in the lungs for a variety of reasons. There'll be thicker mucus. The pathways will constrict, the muscles controlling the bronchi will constrict when they shouldn't. And then also inflammation in the bronchi wall themselves, meaning the wall of the bronchi swell, will ultimately mean that the air channel is narrower. So all of those factors combined lead to a so-called asthma attack. There can be triggers for an asthma attack, so various allergens can trigger a sudden worsening of the symptoms. So symptoms of asthma, like many respiratory issues, will be breathing issues, wheezing, tightness in the chest, a change in respiration rate, usually a rapid breath, shortness of breath, and excessive coughing. Asthma is typically diagnosed before adulthood, and it goes hand in hand with people who have allergies, and a lot of times family history can be a predictor of a risk group at asthma. All right, so here's a diagram showing the various factors that take place during an asthma attack. So muscles are going to constrict. Excess mucus will be in place, and also inflammation in the wall of the bronchi. All of those lead to effectively smaller airways, which is why people wheeze during an asthma attack as they're straining to get enough air coming and going from their lungs. All right, COPD stands for chronic obstructive pulmonary disease, and it's a chronic illness, meaning a long-term illness, and it leads to problems with breathing. So symptoms would be all breathing related, of course: coughing, shortness of breath, tightness in the chest, wheezing. So a lot of the times respiratory symptoms are very similar from one disorder to the next. And COPD is the catch-all term for two conditions: bronchitis, which, as the name suggests, is when your bronchi are inflamed, and emphysema, which is when you lose alveoli. And most people with COPD have both conditions together. So generally, COPD is caused by exposure to some kind of substance. Most commonly, it's cigarette smoke, but it can be chemicals, used at work. It could be frequent exposure to dust. So for example, if you're a construction worker or something like that. So almost always COPD is going to be related to something at work, a repeat exposure to something at work, or smoking. And the majority of the time it is found in smokers. All right, TB or tuberculosis is an actual bacterial infection of the lungs caused by a bacterium called Mycobacterium tuberculosis. And the symptoms are a cough, typically, and it can be a very severe cough in which you cough up blood, a lot of fatigue as your immune system attempts to battle the microbe, and because it's an infection, it often leads to a fever as your immune system is attempting to battle the microbe, and it can also lead to a loss of appetite. All right, and TB used to be called consumption because the loss of appetite ultimately in later stages of the disease meant people didn't eat enough and they would literally waste away. They'd be consumed by the disease, consumption. All right, so TB does spread in the air, so anybody can get it, but some people are more prone to actually get the symptoms, and you're at greater risk depending on where you live. So here in the U.S., we've been very good about screening for TB and preventing it from getting to dangerous levels in our country. One area we've been particularly effective is we are very good at screening our healthcare workers for TB, and that way we reduce the risk of TB spreading and hospital environments, that kind of thing. Other risk groups would be anybody with a weak immune system, because you're going to have a harder time battling an infection if you don't have a sufficient immune system. And children, very young children, infants, have not yet developed a proper immune system yet, so they're at greater risk. And likewise, very elderly individuals also tend to be immune suppressed. So anybody with any type of immunosuppression is at greater risk for developing symptoms from TB.